So I'll request him for his remarks. Please welcome on the podium. Please.
Always I've had the opportunities to represent the government of Balochistan and present in such events here at Islamabad at the Health Services Academy. So I really feel gratitude and I feel proud. The family planning indicators and as well as the malnutrition indicators, they are one of the worst in the region. A lot has been done, a lot is being done, but I believe still we are lagging behind. We have to have the understanding, first of all, as what kind of solutions are required for the province of Balochistan, which is unique in its feature, that it is, in terms of land mass, the biggest province in Pakistan, and the population is very low but scattered. So having scattered population on a very large land mass, that becomes really hard for the policy makers and for the policy implementers to provide services to the communities at large. What I believe, normally till date, this is the problem with the biomedical system of Pakistan and as well as in Balochistan, that we have been focusing upon infrastructural development, if we talk of healthcare system, and as well as the curative side of the very larger context. The investment, if you just keep into consideration, I'm not talking of just Balochistan, but particularly Balochistan since I'm representing, whenever we have the analysis, a larger chunk of the budgetary allocations that is diverted towards the curative side, it means we want the diseases, we want people to be deceased. So what is required, like Dr. Shehzad sir was at the prelude of this conference talking about, to have a comprehensive system wherein not only the curative side, but all the four pillars that include the preventive, the promotional, curative, and then rehabilitation, these all pillars are required to be strengthened. As a student of public health, what I would like to say, I would like to just, rather I call it the prelude to this very seminar which you experts are going to be telling suggestions to this forum, which can be then later on shared with all the provinces and the provincial governments as well as at the federal level. We have to have paradigm shift in our thinking and to reshape our system to address the emerging diseases of not only the communicable disease but also the non-communicable diseases and those diseases which are causing resistance to the medicines. We have to have a system that should be focusing on all the four pillars of the healthcare system. As a student of public policy and public health policy, I say we have to understand two things. The very thing we have to understand and we have to act. What to understand, this is the very important part. We are very reactionary in our approach. We don't understand and we act and react. We are not proactive on resources. So what can we understand? We have to understand two things. As Professor Greg Martin states, that we have to understand two things. One is the exposure. The exposure to what? The exposure to the risk factors. And then we have to understand what are the outcomes. The outcomes can be the disease and the disability. And what is the relationship of the outcomes and the risk factors? I mean to say the causal relationship between the exposure to the risks, the risk factors, and the diseases, that includes the diseases and the disability. We call it in public health the outcomes. Once the understanding is had, how can we have the understanding? For that we need to have a very robust surveillance system and as well as research and development wing, which we lack normally in the provinces. I'm not talking of just Balochistan, but I believe in the rest of the provinces as well, we lag behind in terms of research. And that's why for the policy makers, proper guidelines have not been there. If they were there, we would not have these worse indicators. So understanding the risk factors and the outcomes, then we have to understand what are the two factors therein, that are the magnitude and the distribution. What is the magnitude of the risk factors? The magnitude of the outcome, I mean the disease and the disability, and what is the distribution geographically and socially. Understanding this, then the healthcare policy makers can propose action, that what action is to be done. I would like to repeat what Dr. Shehzad said. In action, we are not only aiming at targeting the sick people. Rather, we have to include both the sick and the healthy people. Targeting the healthy people will require action through preventive measures. We have to have a robust prevention protocols under which there are two very basic indicators. One is to promote behavior for change, proper diet, hand washing, exercising, and second is to reduce exposure to risks. I just would like to share with you a few days ago, we had a meeting with regard to radiation in the radiology department when we had the evidence and data in most of the tertiary level facilities. The protocols are not being adopted. And recently we had the outbreak of Congo in the month of October, Congo outbreak in one of the tertiary care hospitals in Quetta. That was my third day in October when I joined. We had this outbreak inside the hospital in the medicine ward. I got shocked when I had the data that due to the lack of IPC protocols in the tertiary hospital in Quetta city, we have had this outbreak. Okay, healthcare system we have in place. For example, in Balochistan, we have primary healthcare wherein there is a huge number of more than 750 basic health units, more than 100 rural health centers, MCH centers, civil dispensaries, community level healthcare providers, for example, LHWs, the health force of the population welfare department. Yet we are confronted with the problems that the burden is always shifted towards the secondary care facilities and the tertiary care facilities. What can be the reason? Which the conference, the experts here, the researchers here, the policy makers here, the students and the researchers should tell the policy makers that what are two things and how can they be assessed. The very first one is the capability of the system to check whether or not the governance model in place is effective, leadership problems are there or not. So we have to change the behavior and we have to have the instrument of reducing exposure to risks. Once you have this very protocol in place, then action towards addressing the issues of the diseased people, for which again two things are there: access to safe and effective treatment and proper healthcare system to provide services to the masses.